Hi, I'm going to be talking today about minimizing workplace violence in healthcare. So what is workplace violence? So OSHA defines workplace violence as any act or threat of physical violence, intimidation, or other threatening, disruptive behavior that occurs at the work site. So why do we want to talk about techniques that minimize workplace violence? So by recognizing escalating behaviors in our patients and the techniques to utilize can protect from harm. And according to the United States Bureau of Labor Statistics, healthcare workers accounted for an astonishing 73% of all non-fatal workplace injuries and illness due to violence in 2018. So by industry, workplace violence in healthcare is high. What contributes to this? Well, we work in stressful environments. We deal with patients, we deal with people, not products. And as nurses and healthcare workers, we should advocate for improved workplace policies and education measures that protect us from violence at work. Some risk factors for aggression that we could potentially see in our patients. Substance abuse, drugs and alcohol, dementia, delirium, any kind of cognitive impairment, pain, especially untreated pain, feelings of being mistreated, the patient who received bad news or have an unknown diagnosis, the worry about the cost of healthcare, and just general fear and anxiety. Also insufficient resources for mental health and substance abuse. So typically in the hospital, we see patients when they're in crisis. Other risk factors include the loss of privacy or temporary restriction of rights. And this includes when we place patients on mental health holds. The taking away of things from our patients. So when we take food away from them, we make them NPO for test or procedures. And then also doing something to the patient without collaborating with them, that's huge. Environmental factors that could potentially increase aggression, wait times, allowed crowded waiting rooms, ease of access of items that could potentially be used against us, like the stethoscopes we wear around our necks, lanyards, scissors that we carry in our pockets. So emotion often escalates in a predictable cycle, and we call this the aggression continuum. So patients can go from calm, anxious, to agitated, to aggressive and violent. And we'll talk about each of these phases. So our calm, coping, rational patient. So this patient may appear calm, but they may have some internal distress. And patients who typically come into the hospital experience a loss of control, trust, dignity, autonomy, and then a love connection. So we saw a lot of that during COVID with our visitor restrictions. So interventions to prevent anxiety and keep our patients calm, we want to utilize ADDET, which is an acronym for acknowledge, introduce, duration, explain, and thank. So acknowledge, we want to greet the patients by their name. We want to make eye contact and smile. We want to introduce ourselves with our name and our title. Duration, we want to give accurate time expectations for tests or physician's arrival, etc. And when that's not possible, we want to give the patient a time frame for when we would be able to update them on progress. Explanation, we want to explain step by step what the patient can expect next. We want to answer questions, and we want to let the patient know how they can reach out to us. Thank, we want to thank the patient and family. For example, we want to express gratitude for their patience and cooperation. Our anxious, worried, frustrated patient. So this patient may have, behavioral signs we may see with this patient include vital sign changes. They may have an elevated respiration rate or heart rate. They may be sweating. They may have repetitive words or gestures. They may perseverate on topics. They could have a high-pitched or wavering voice, maybe pacing, crying, or have other nervous habits. So interventions. So we want to utilize LEAPS, which is an acronym that stands for listen, explain or empathize, ask, explain, paraphrase, and summarize. So listen, we want to actively listen. We don't want to interrupt. We want to maintain eye contact. and we want to listen with the intent to understand. Empathize. We want to be kind but neutral. We don't want to judge or make excuses or place blame. We want to connect with an attempt to understand the patient's situation. So ask, explain. We want to have the patient please explain their situation. We want to avoid the why did you questions. Paraphrase. We want to verify the patient's understanding. So we want to use only facts. We don't want to guess. Summarize. We want to agree to a response or solution, but be careful of making false promises. And at this point, we're going to want to discuss a plan with the care team and possibly get some, consider PRN medications for anxiety. Our agitated, distraught, defensive patient. So behavioral signs we could potentially see, they could be challenging, demanding. They may have a raised voice. They may be making vague threats. They may be difficult to redirect or sensitive to feeling shamed or disrespected. So interventions, we want to be firm but respectful. We want to identify and acknowledge their feelings. We want to speak in a calm tone of voice. So if the patient's raising their voice, we want to make sure that we lower ours. We want to provide the patient choices and then allow for a reasonable time for them to decide. We want you need to trust your intuition. So if you have a gut feeling about something, you need to acknowledge that. And then at this point, you're going to want to utilize the buddy system and not enter these patient rooms alone. Other interventions include removing items that could be used as weapons, as I mentioned before, the stethoscope, lanyards, scissors, or other items in the room that could be used as weapons. You want to stay out of the strike zone, which is 1 arm length away from the patient. Importantly, you do not want to place the patient between yourself and the door. You want to be able to exit out quickly if need be, and you don't want the patient to be able to pin you into the room. And again, you're going to consider PRN medication and discuss a plan with the care team. So aggressive, violent, threatening, irrational patient. So this patient may be a danger towards self or others, whether that be perceived or expressed. They may have a clenched jaw or fist. They may be shouting or swearing. They may have be intending to intimidate. They may have excessive staring, glaring, posturing. And at this point, patients typically cannot be verbally redirected. They have diminished reasoning capability. So interventions, we don't want to argue, we want to remain calm, lower our voice, and we do not want to negotiate. We want to obtain assistance at this point. We want to get security involved. Again, stay at a safe distance, utilize the buddy system. Again, remove items that can be used as weapons, discuss a plan with the care team, and consider PRN and medications. And at this point, we may need restraints for violent behavior. Additional tips. So do not attempt to stop a patient who's agitated or aggressive from leaving. You could potentially get injured. You want to utilize security and get them involved to help. Maintaining situational awareness, very important to pay attention to what's going on around you. Communication is vital, so using your verbal, nonverbal communication skills is important. And again, do not put yourself in harm's way, and then do not intervene alone. Lastly, so associate safety comes first. Violence is not a part of the job.